Hello everyone. Today I'm going to explain about the cannula color and size. Sometimes, many times we are unable to remember the cannula which color and what is the size, what is the gauze. So we are facing very difficulty to find that cannula color and size also. Okay, and so for this I have prepared a mnemonic that is VYPPZWZO. If you remember these words, definitely you're going to remember the all colors of the cannula and their sizes also. How? Yes, V means violet, Y means yellow, B means blue color, P pink, green, white, gray, orange. So these are the things here. If you remember this mnemonic like Venki, why VP goes well and goes off. You can use instead of Venki, you can use any other name, Vani, Venu, or whatever, whichever name you like that you can keep over there, or simply you can combine together as why VP goes well and goes off. So for this, I explain in the next view. I hope it will going to help you in your further studies and in your clinical settings. So I already said that V is V for violet color. It is 26 gauze. So if you remember Venki, why BP goes well and goes off, like it comes like in a order, like violet, yellow, blue, pink, green, or white, gray, orange. So if you remember the sizes also like 26, then after within two two digits like 26, 24, 22, 20, 18, 17, 16, 14. So this is very simple if you remember this. So violet for 26 and yellow for 24. And at the other side I also given the flow rate per how much ml it will per minute it will go. Like violet uh, can send 13 ml per minute and yellow 20 ml per minute according to their strengths, like according to the size of the needle. So these are the mls per minute, like yellow for 20 and blue for 36. And you can see, you can easily remember this 36, 60, 90. And white for, sorry, I'm unable to mention that, gray for 180 and orange for 240 ml per minute. Then violet is mostly used in neonates because you can also see, we everyone know that 18Z is the largest, like we can send for, we can use for blood transfusion. Everyone can remember this. We everyone can know that green color is blood transfusion, but at the same time, so you can compare this 18 and 26. 18 is for blood transfusion, then 26 is the smallest size. So in that only 13 ml per minute only it can go. So it is only can used in neonates only. Neonates in that, why? Because of neonates, because their veins are very thin than older adults. So this type of cannula can use in neonates. And coming to yellow color, this is also mostly used in neonates and children and old people, elderly people also. Why elderly people? Their veins are very prominent, like, no, in elderly people their veins become thin, like that. So in them also we can use. Then coming to blue color, it is a 22 and it can send 36 ml per minute, and it is also used in children and older adults also. Many of us, when we are in hospital, like 18 years adults, they also keep blue color cannulas, if you remember means. Then pink color, it is for normal IV or blood transfusion, and green color mostly we are seeing in hospital for any blood transfusion and for any trauma injuries like burns cases or any accidental, and in any surgeries, during surgery, after post-operative, pre-operative, we can use for sending large amounts of fluids to the patient. An electrolyte imbalance, we need to replace the fluids in a less time. So in that time, this green color cannula and a white color cannula, this is also for blood transfusion and IV medication. Then coming to gray color, it is a 16Z and it can send 180 ml per minute, and it is also used in trauma and surgical procedures. You might have think that green color is also a blood transfusion, and gray color what is. You can see that sizes varies. And the surgical procedures, sometimes we need to insert fluids into the cavity to remove the to excrete some wastes and all. So in that we need to insert more fluid at a time. So in that surgeries, trauma and surgical procedures, they will use this gray color and orange color. So that's why we are not seen in a normal wards and all. So I hope you will understand my topic and